61% of Africa imports, or 61% of pharmaceuticals are imported into the continent. 36, so that's in dollars, euros, pounds, etc., etc. 36% is locally produced. When I say locally, I mean across the continent by about 300 to 600 manufacturers, but not traded across the continent. So locally produced, we self-consume. Only 3% moves across the continent. Now, when you look at the fact that we only have 50% of people receiving healthcare, and the rest of that, the rest of the other 50% have got huge costs in terms of healthcare. So this whole project is about how do we make healthcare, first of all, accessible to more of Africa's people? How do we start to manage the costs down? One of those ways is looking at, you know me and the AFCFTA.
Yes.
One of the ways is looking at how do we use or leverage the benefits of the AFCFTA, which means, you know, intra-Africa trade optimization, no tariffs, NTBs are dealt with, etc., etc. So when we look at this, Project Africa First is about how do we now start looking at ensuring that pharmaceuticals are manufactured on the continent. Pharmaceuticals have got, or packaged medicine is able to move across the borders more freely. Access, we need to save lives. People shouldn't be dying from things like diabetes or heart disease.
And obviously, Yavi, it is now more urgent than ever as we see the impact of the US funding cuts already.
Absolutely. So the US funding cuts have worked in two ways. Obviously, it's been a harsh blow to a lot of our infrastructure, our manufacturing, our just the healthcare industry in general. But it's also given us a wake-up call.
Yeah.
Because if you remember, a couple of years ago, during COVID, or when COVID started, Africa was left behind. We were promised, and then we were never given. Mpox, a couple of months more recently,